Welcome to the ONC IT certification. Welcome to the ONC Health IT Certification Program Developer Roundtable. My name is Tom Deneen with Kaufman and Associates, and will be assisting with the logistical support for the Zoom session. To ask questions, click on the Q&A button at the bottom of your screen. If you have general comments, please click the chat button also at the bottom of your screen. This will pull up a chat box which will open to the right side of your Zoom interface. Additionally, we ask that you select the speaker view option located at the top right side of your Zoom interface. This will allow you to see the speaker as they present or share information. If you need technical assistance during the session, please type the issue into the chat box. One of our techs will respond to you. Finally, please be aware that today's session is being recorded. The recording and slides will be made available on the ONC events page. Closed captioning is available by clicking the CC icon at the bottom of your screen. I will now turn it over to Rob Anthony.
Thanks. This is Rob Anthony. I am the director of the Certification and Testing Division, and we have the honor of running the ONC Health IT Certification Program on a day-to-day basis and interacting with many of you. Thank you for joining us. Can we go to the next slide? This is just our standard disclaimer to let everybody know we do everything we can to present you with the most accurate information that we possibly can. Obviously, there are some times that guidance and other things may shift from the time that you actually hear this recording to when things are implemented. This isn't actually a legal document. Obviously, the regulation at the end of the day trumps everything. If you have questions, please go to our website and make sure that you take a look for any information there. Next slide. We have a variety of speakers today. We have Sean Spurlock, who is our communications guru in our program administration branch. We have a number of folks you can see from our tools and testing branch. Ashley Hain is the acting branch chief, but Scott Bowen, Joey Hua, Aaron Little, Keith Carlson, John Bender show you on the next slide the agenda that we're going to go into. We'll do some basic updates about some coming dates with the certification program that I think all of you are probably familiar with, but we want to make sure that you have it all on your calendars. I'll do a little bit of coverage of some B10 EHI export questions that have come up since last we spoke, and also a brief update about CMS EHR certification ID updates, and then the tools and testing team in that final agenda item is going to take us on a little bit of a deeper dive about all of the tooling that is available through the CERT program and through the certification website for your testing and certification needs. So next slide. I'm going to hand this over to Sean Spurlock to walk us through some of the coming due dates.
Hi, Rob. Thank you. Hello, everyone. Thank you for joining us today. My name is Sean Spurlock. I'm with the Program Administration branch within ONC Certification and Testing Division. As Rob said, I am going to go over some quick updates regarding the ONC Health IT Certification Program. Next slide, please. The 2023 approved SAP standards became effective for voluntary use in our program on September 11th of this year. And if you recall, during our last developer roundtable, these standards were announced on July 12th. And as a reminder, the comment period for the 2024 SAP cycle begins in February of 2024 and will be set to close 90 days later that May. And for an in-depth overview or any reminders of how the SAP cycle works, please visit our SAP page, which is linked to the right. Next slide, please. So during the last roundtable, we did a little bit more of a deep dive in the SAP cycle and the actual process, but just a quick reminder that SAP is an annual process that allows health IT developers participating in the ONC certification program to voluntarily update their health IT modules to use approved newer standards, newer versions of standards than those that are adopted in regulation. And this flexibility is similar to standards and implementation specifications that are adopted in the certification criteria required to meet the real-world testing condition of certification. Next slide, please. For health IT developers with modules certified to applicable real-world testing criteria, the 2024 real-world testing plans must be publicly available in the chapel by December 15th of this year. The results from 2023 real-world testing plans are to be made publicly available in the chapel by May 15th of 2024. And as a quick reminder, that real-world testing is a process by which health IT developers demonstrate interoperability and functionality of their certified health IT in real-world settings and scenarios, rather than in a controlled test environment with an ONC authorized testing laboratory. Next slide, please. All right. Quick reminder that the attestation submission window, which opened at the beginning of this month, will be closing this upcoming Tuesday, October 31st, 2023. Certified health IT developers are to submit their attestations to their ONC ACB for review using the chapel. Next slide, please. ONC will be hosting the 2023 ONC annual meeting in person this year in Washington, D.C. on December 14th and 15th. For registration, as well as more information, including an agenda, lodging information, etc., please visit the ONC annual meeting webpage. Next slide. As a quick reminder before Rob goes into a little bit more detail on B10, the deadline to certify to this criterion is December 31st of this year. And with that, I will turn it over to Rob to discuss the EHI export criterion.
Excellent. Thanks, Sean. We have been doing this B10 review at all of our developer roundtables this year. I'm going to do an abbreviated version this time around. I know that many of you have already been engaged in the process with your ACBs. If you do want a deeper dive about B10 and the EHI export requirements and the requirements around this criteria for certified health IT and developers, please look at our previous recorded roundtables. There's also a B10 fact sheet that you can find on our website that will give you a fuller picture. I just want to cover a couple of basics and a couple of questions here that have come up in the meantime, so we can go to the next slide. A reminder that the B10 requirement is part of the assurances maintenance of certification requirement that is incumbent upon all developers that participate in the Certified Health IT program. If you have a product that electronically stores EHI or causes EHI to be stored, or is part of a larger product that does store EHI or uses relied upon software, all of those are things that will require you to get certified to the B10 functionality. I have seen a couple of things where people have indicated that, well, we're certified in the program, but we're not really an electronic health record system. That actually does not matter. It is not part of the certification requirement. The requirement is if you have a module that causes EHI to be stored, whether it is your EHI or someone else's, there needs to be a B10 certification component for that export. If you feel that you do not have this, this does not apply to you, please engage immediately with your ACB about what kind of paperwork they need for you to indicate that this does not apply to you, because they are going to take some documentation from folks to show this. Couple of questions that did come up that I just want to make sure that people know, and we did cover this first one at our last meeting, but I just want to reiterate. If you're a developer that has a certified health IT module in our program, you can certainly use a third-party solution for this B10 export, but you have to incorporate it as relied upon software with your product. You can't simply direct customers to go get this third-party solution and not mess with the B10 certification. You're going to have to incorporate it as relied upon software as part of your product. This is, again, something that is a requirement for developers who participate in the program if your product does this, and the product needs to be able to provide that functionality to the end users. So you will have to certify it, but you can do it as relied upon software. So just wanted to cover that quickly again. The other question that has come up, honestly, with a couple of end users that have reached out to us, so some hospitals, some physician offices who have indicated that they don't really have plans on using B10. What do they need to do for the program? And of course, the program doesn't require anything from end users, but what I wanted to make sure that all of you knew is that, there is this open question of, do the customers actually have to accept that B10 update if you update the product with that certification? Do they have to use that B10? There's nothing incumbent upon your end users to actually incorporate this functionality or use this functionality. The requirement is that you have to be certified to B10 and that you must make the functionality available to those end users. If they choose not to avail themselves of that available functionality, that is outside of the realm of your control and has no bearing upon the certification. As long as you have certified to B10 and end users have access to that functionality by the December 31st date, then you are meeting the requirements. Next slide. I think we might have an earlier version here, so I'm going to skip through these slides very quickly. This will go through what exactly we describe as electronic health information. Much of this is covered in our fact sheets. Let's go ahead and go to the next slide. This is a question that has come up a couple of times. We did, again, cover this last time. I just want to make sure that I'm explicit about this with everything. We have gotten a couple of questions from developers and also from end users who have asked, if I have this B10 in place, is this enough for me to comply with all of the information blocking requirements? And I just want to emphasize again, B10 is not explicitly designed to fulfill any kind of information blocking or information sharing related to those information blocking regulations. B10 is a developer requirement. It is not a provider requirement. The purpose of B10, as we have described it within the regulation, is to enable export of electronic health information for a couple of very specific scenarios. One of them is for single patient use so that patients can get all of their electronic health information and take it to another provider or whatever. The other is for a all patient population EHI export so that data can be migrated from one health IT system or module to another. There is nothing specifically about B10 that addresses information blocking. That said, we do know that some people are sort of combining some of these and allowing some of the information requests to be met through that B10 functionality. Nothing precludes that. I just want to make sure that people know that one is not necessarily equivalent to the other, and there may be additional information blocking requirements that you have to look at that are not covered by B10. Next slide. And then here you go, as always, these links will be in the slide, which will be put onto our website, but you can also see these in the program resources area. We have a B10 EHI export fact sheet that gives a pretty good overview of what is required and who is required to do what. We covered some of this in number 3, which is the blog that is about getting ready for EHI export and provides a real quick snapshot of some of the information that is in that fact sheet. And of course, many of you are familiar with our certification companion guides, which we affectionately call CCGs. That distills all of the language that you would find in the regulation and any kind of clarifications that we have issued over time. One thing that we haven't listed here, but you will also find in our on our website, is some of the previous roundtables where we have discussed B10. I would encourage people to take a look at that. I'm going to take a look really quick because a Q&A just came through on this. Somebody is asking that they know that they have to meet the vendor requirements for certification. Not a provider, they know it's not a requirement for provider customers to use. But you have customers who are asking if they will still be in compliance of having certified software if they do not accept the changes for B10. There is nothing that would preclude them from having certified software. Many of them are asking this in regards to their program participation on the CMS side. There is nothing on the CMS side that specifically requires them to have the B10 certified software in place. So in that respect, there is nothing that would prevent them from participating in programs if they do not accept the upgrade for B10. We do know that there are a number of providers who have some mapping and other issues that they need to deal with on their end and are not ready to implement B10 and so plan on doing it a little later in 2024. Nothing should have any issues with that. You're welcome to send people to ONC for any of those questions. We have the JIRA system, customer feedback system that people can submit a request. They can also reach out to CMS about this. Next slide. One quick update here. I think folks have seen this. We let out some information on our listserv about the CMS EHR Certification ID updates, but we have gotten a few questions from providers, and I imagine some of you will get these questions from providers as they begin to attest for both quarterly and yearly program requirements. If we go to the next page, we have updated the certified health IT product list. The CMS EHR certification IDs, which you can generate through Chapel, they previously included both a 15E and a 15C number. The 15E syntax IDs matched up with 2015 edition certified products. 15C matched up with the 2015 Cures Edition update products. We have sunset the use of 2015 edition certified products. Only systems that are made up completely of 2015 edition Cures updates will be able to generate a CMS EHR certification ID. We are following the CMS program lead. This is consistent with the guidance that they have put out, that hybrid certification and 2015 edition IDs are no longer permitted in their program, so we have sunset that. We are still getting some questions from folks asking about, but we have both and we are using both. Again, we tell them that this is consistent with CMS's program guidance. We would anticipate that if they reach out to you, you may want to send them to this third bullet below if they have questions about any of the programs, whether it's promoting interoperability, QPP quality payment programs, the inpatient quality program. There is a CMS quality support answer help desk that people can submit information to. Again, this is just consistent with the CMS policy, so that's why you see the sunset and you may get some questions. All right, next slide. Now I'm going to turn it over to Ashley Hain to walk us through the beginnings of a great deep dive into ONC tooling.
Thank you, Rob. As Rob mentioned, my name is Ashley Hain, and I am the Acting Tools and Testing Branch Chief. And today, our Tools and Testing Branch team will be providing a 101 session for the available ONC certification program tools. Our agenda will consist of a quick high-level overview before the team will provide an overview of the individual tools. Please feel free to ask questions throughout the live Q&A, and we will do our best to respond via chat. Or if we have time at the end of the presentation, we will do our best to answer questions at the end live. And the next slide, please. And to kick off our overview, we identify through regulation certification criteria and for the program, and that criteria can either be attestation-based or they require certification tools and testing prior to certification. The certification criteria can be found on healthit.gov, and within that criteria, we have certification companion guides that identify standards and implementation guides and general requirements and test procedures. And as you can see here, Johnny is showing his screen to where you can actually find the certification criteria guides. And then in the current slide that we have a ONC conformance test tool page. And this page is really critical for the test tools. It identifies every single testing tool that we have for the program. It identifies the actual associated criteria that will be tested through that tool. And it also identifies the base standard that is required for certification for the associated criteria. We also have at the bottom of the page, we identify that there is a standards advancement process, and the national coordinator on an annual basis can approve updated versions of the standards outside of the regulation process. And then there's also like the base standard will always be in regulation, but for the SFAP process, Health IT can be certified to newer versions as long as it's identified on that SFAP list. And then if we could move to the next slide, please. And here we are showing the testing workflow steps, and we have defining requirements for the tests, which for the ONC certification program are generally based on implementation guide conformance requirements and other certification program specific requirements, establishing baseline artifacts for testing, and it includes the tests themselves. We have the reference models and like reference servers or clients and reference data. Reference models replicate the functionality of a read or search requirement. It can't be accomplished through a database alone. API requirements cannot, so it can serve from a database. And then the test systems will test and verify conformance to the requirements and artifacts that we have set up. And also a lot of this is also outlined within our test procedures that Johnny also showed and shared his screen before. The place to go to find our test procedures. Next slide, please. And now we will be diving into the specific tools, and I will be handing off to Scott Bohan for the HL7 fire tooling.
Great, thank you, Ashley. Hello, I am Scott Bohan. I work at ONC in the Tools and Testing branch, and I'm here to talk about fire testing. So we can go to the next slide. All right, to start, we will discuss how the fire standard is relevant to the ONC certification program and its testing tools. So FHIR is a standard for the digital exchange of healthcare data, and FHIR APIs are required as part of certification to the G10 Standardized API for Patient and Population Services criterion. The G10 criterion is designed so that provider systems containing clinical data can be made accessible via FHIR APIs, one for individual patient data and another for bulk data access. And listed on this slide are testing tools relevant to testing the G10 criterion FHIR APIs. So first is Inferno. Inferno is an official testing tool for testing the requirements of the G10 criterion. And in addition to supporting the ONC certification program, in an official capacity, it is also a platform for general fire testing. Inferno can be used by health IT developers in their software development cycles to help verify their implementation's conformance to fire. Inferno supports many fire implementation guides, such as US Core, Bulk Data Access, and Smart App Launch. And additionally, Inferno is open source. This means that Inferno code is free to use, benefits from community review and feedback, and provides the documentation necessary to be adapted for other use cases by the community. Inferno is based on the Ruby programming language to provide test writing flexibility, and as a platform can support the development of tests for new fire implementation guides and related standards. Second is the Aegis Touchstone tool. Touchstone provides testing for many fire implementation guides and also supports testing of the G10 criterion as an alternative test method. An alternative test method may be approved by ONC as an option to meet certification testing requirements. Touchstone was approved as an alternative test method in 2022 for the G10 criterion. Touchstone uses and extends the fire test script resource as a means to write fire tests. Next slide, please. So this slide summarizes some of the major technical components of Inferno. So in the center is Inferno Core, which provides the fundamental technical capabilities needed for writing tests in the Inferno framework. Inferno Core includes a domain-specific language, which is designed to streamline writing tests for fire APIs. Inferno Core also includes developer-friendly features, such as a built-in web user interface, as well as an API and command line interface. Tests written using Inferno Core can be bundled together with supporting artifacts into test kits. For example, the G10 criterion test kit includes a collection of tests for the ONC certification program for verifying conformance to the G10 criterion. And additionally, there is a supporting reference server and data generator, which provides a model system for demonstrating conformance to the G10 criterion test kits tests. Other Inferno test kits for fire implementation guides can be found on inferno.healthit.gov and GitHub. And test writers that are interested in making their own Inferno test kits can use the template test kit available on GitHub to get started. I'll also mention that Inferno supports many extensible features, which can provide utility to developers and test writers, such as testing configuration presets, automated test generators, and installation utility scripts. We can go to the next slide. And we can walk through the Inferno homepage here. We've navigated to inferno.healthit.gov, which is the landing page for ONC's hosted instance of Inferno. It has links to hosted test kits and documentation for writing your own test kits. So we can click the link to the G10 test kit to launch a new testing session. And this is the test kit landing page. On the left is a description of the test kit. And on the right are options we can select to configure our testing experience. The options here are the standards available to be tested, including the base regulatory standards and those adopted via the standards version advancement process. So proceeding to the next page, we are taken to the main Inferno testing interface. On the top, we have the test kit name and selected options for reference. And then slightly below that is a menu for selecting preset test parameters. For example, the G10 reference server parameters can be selected as a preset, which will populate the details of the reference server into the tests as inputs. We can then run the tests. Here is the input page where testing parameters can be input. And those can be input as either free text as a field option, or through if the testing parameters have already been generated, we can input those as either JSON or YAML files, to save time during the testing process. So if we run the tests, we'll be able to see the test details both in the menu on the right, which has the technical testing details, and at the end in a report, which will summarize the test results. And then I'll also just mention that at the bottom right of the screen are links where a tester can report any issues that they discover with the tests, as well as a link to the open source code for the test kit. And then again, here is some helpful links about fire testing. And then I will pass it over to Joey to present the next section.
Thank you, Scott. Good afternoon. I'm Joey Hua with Tools and Testing Branch. I will be walking through the site/ETT tooling platform. The ONC portal site, an acronym for standing for the standard implementation and the testing environment, comprises a collection of tools, sample data, resources, service, and useful links. And this platform assists the healthcare community in implementing health IT standard and promoting interoperability across health IT systems. We have the URL to the site platform provided here on the slide. Site also serves as the primary gateway to ETT or edge testing tools, which validates the certification requirement for both the 2015 edition and the 2015 edition Cures update. Next slide, please. Sorry, I think that you skipped one. Yeah, that's one. This is the schematic architectural drawing of sites, which features a multi-layered modular architecture. As the slide shows, this relatively sophisticated system consists of management, business, security, presentation, data access, and other utility functional modules. Next slide, please. And the ETT certification tools are used to test the conformance with the 2015 edition and the Cures update criteria H1 and H2, which regulates health data transportation method and protocols. The major ETT testing tool components include direct test, HISP, or the Health Information Service Provider test, and edge test. Just to mention, H1, the direct project criterion regulates HISPs for secure, HIPAA-compliant, nationwide critical data exchange. And H2, the direct edge protocol XDS criterion standardize the process of transforming the HE-XDR and HE-XDM profiles into internet format messages, and vice versa. And as a tooling hub, site also provides an array of messaging validation tools. My colleague Aaron will walk you through these validators. Aaron, please.
Thanks, Joey. My name is Erin Little. I'm going to talk to you about message validators. So what are validators? They test the conformance of artifacts to industry standards and specific criteria. This is inclusive of CCDA, XDM, XDR, direct message. And so you can do both general testing. So there are context-free validators for general testing. And you can also test against the criteria for the 2015 Cures edition. And so if we go to the site, this is what our current validator home looks like. And the menu across the top of the screen gives you different options. If we were just to choose SFAP as an example, the first section on the screen is where you can do your general testing. You can upload your files and validate your documents there. And the second section on the screen is where you can be a little bit more specific in your testing. And so you can decide if you're a sender or receiver. You can select from the drop down in step 2, based on the specific criteria you want to test against, if you're ambulatory or inpatient data. And this is where you can input that information and you can download those files. Also, if you want to download all the files from the repository just to take a look at what that sample data looks like, then you can do that as well. And so that in a nutshell is a quick overview of the validators. So next, and these are just some screenshots of that, I'm going to talk about electronic prescribing testing. And next slide. So electronic prescribing testing is specifically for the B3 certification criteria for electronic prescribing. Just some background on the testing tool. This was developed by the National Institute of Standards and Technology, NIST, and is currently managed by the National Council for Prescription Drugs Programs, NCPDP. This is an ONC approved testing partner. So we collaborate with NCPDP with the ongoing maintenance and updates of the current tooling. The most current standard that we use is the NCPDP script standard, version 2017071. And the testing suite supports a variety of functionality, including transport, messaging, and functional testing. I included some screenshots in the presentation. You will have to create a login in order to access the tool. But just to quickly kind of give an overview of what general usage looks like. So there's also context-free and context-based testing in the prescribing tool as well. And this particular screenshot is for context-based testing. And so on the left-hand side are all of your specific test cases that you choose from. I've selected prescriber creates a new prescription message and sends to the pharmacy as the scenario that we're going to look at. And so when you select your specific scenario, what it does is it gives you some background and all of the necessary information provided in the scenario. And if this were the real screen, we would click on load test step, which is a green button on the right-hand side of the screen, and go to our next screen. And what it would look like is this. So you will have the option to load your code, your XML code, into the message content area of the screen. We also have example code if you wanted to kind of look at what a working example looks like, and that's what's in there now, just to compare. But once you load your XML code there, you'll test by clicking validate, the green button, and on the bottom of your screen, if any errors or warnings or anything are read in your code, they'll appear down there. The top of the screen here will show you the outcome of your test if you pass that particular step. Because if there are warnings, you can still pass, for example. And so that's pretty much how this works. You can go through each step and you just pull out each part of your code. And you can test each step to see if you've passed when it's validated in the prescribing tool. And I'm going to pass it on to Keith for the next part of the presentation. Thank you.
Yeah, thanks, Erin. This is Keith Carlson in the Tools and Testing branch. And for the next couple slides, I'm just going to talk about our testing for our electronic clinical quality measures, otherwise known as ECQMs in the program. So just for some context setting, our ECQM criteria are finalized in section C of our 2015 edition Cures Update criteria at 170.315. We have 4 C criteria, and across those criteria, we have finalized ECQM requirements related to, import, export, record, filter, and calculate, specifically for ECQMs used by CMS's quality reporting programs. One interesting thing about the testing ECQMs is that they exist in a fluid environment. So they're updated on a yearly cycle. These CMS, quality programs in general, and particularly the CMS quality reporting programs, update their ECQMs on a yearly cycle. And so each year, certified systems need to update their systems to demonstrate compliance with the latest updates to the ECQMs. And this is something that our tool supports. It is regularly updated on a yearly cycle to support this and make retesting hopefully as easy as possible. So we can go to the next slide. We'll talk about this, the tool that tests these criteria. It is known as Cypress. And, it validates kind of the EHR system's ability to correctly calculate ECQMs, based on the C criteria I just talked about before. Cypress is the current and only official testing tool for the 2015 edition Cures update and the ECQM-C criteria, and it is supported by ONC. And we can go to the next slide. So this just kind of gives a, kind of in pictures, an overview of some of the steps that you'll go through, and then the different things that'll be tested throughout a Cypress testing session. You kind of start with a patient record, and then there are just different steps for, kind of following that information through different workflows and doing calculations. And throughout this whole process, you will be interacting with Cypress to, and Cypress will be kind of evaluating and making assertions on the data that is imported and exported, the data that is handled throughout these steps. So we can go to the next slide. So how, in terms of how Cypress is made available, the quickest and easiest way to access it right now is to go to cypress.healthit.gov. I saw you had, this is what our front page looks like, and you can see a bunch of information on creating an account and, just reading more background and kind of these boxes throughout the web page. We encourage folks to poke around here. We can go back to the slides, because that instance that was just shown is our publicly available ONC hosted instance of Cypress. But we also make Cypress available, because that instance is kind of a demo server. And so Cypress is also made available for download on, your own development environment or your own machine. We distribute it as a virtual machine, an Amazon virtual image. And then also the source code is completely open and freely available. So you could drill down into that level if you would like. But yeah, with that, I think that's the overview of Cypress, and I'll turn it over to Johnny next for public health.
Fantastic. Thank you, Keith. Yeah, hey, I'm Johnny Bender, Tools and Testing Branch. I'm going to cover the public health criteria and the tools that we make available to support them. So there are 7 public health criteria, public health specific reporting criterion in the certification program, F1 through F7. And they include transmission to immunization registries to support states and CDC, syndromic surveillance for detecting syndromes, generally in like hospital-based environments, transmission to public health agencies, reportable laboratory tests and results, transmission to cancer registries to support state cancer registries, electronic case reporting to monitor potential outbreaks, antimicrobial use and resistance reporting to monitor AUAR nationally, and then healthcare surveys to support the NCHS, CDC, National Center for Health Statistics, I think, office. And so the criteria, like I said, primarily support public health reporting for state and federal programs. And all these standards are currently based in HL7 V2 and CDA. We recognize that there's a lot of like HL7 fire work going on with public health right now, but currently the certification criteria in the ONC certification program are based in the HL7 V2 messaging standard and CDA document standard. And all of the criteria listed above have software-based testing methods besides the F5 criterion, which is sort of a functional requirement, includes functional requirements, and is attestation-based. And also just want to mention that most of the criteria leverage the sort of NIST suite of testing tools that they make available for HL7V2 and CDA. You will recognize NIST also supports the electronic prescribing CDA tooling. So they, it's the same user interface. And if you navigate to, if you search on Google for like NIST ONC certification, they have this nice landing page, which lists out the NIST testing tools for the ONC certification program. So that includes links to all of the criteria that I mentioned. And also you can see the links to electronic prescribing, and then also links to our edge testing tool and some of our resources as well. So that may be helpful for folks. And so just to dive in, like I said, our public health criteria are based in HL7V2 and CDA. So I'll sort of separate it out into the HL7V2 base criterion and the HL7 CDA base criterion. So generally, NIST makes available sort of this HL7V2 resource portal, which includes several tools and utilities to support HL7V2 messaging, including some that are leveraged by ONC certification program, but also includes sort of more than that. They include a lot of utilities for HL7V2 testing. I believe I have it here. So you can see, they have like profile generation, test case generation, some web services. They even have some publications and resources. And then, like Keith mentioned for Cypress, and Scott mentioned for Inferno, most of the tools that we make available for the certification program, majority, like probably greater than 90%, maybe almost all of them, are available as open source code, so that folks, our partners, industry can download and implement the testing tools locally. So they don't necessarily have to be interacting with these as like a software as a service. However, we have found a lot of utility in hosting several of these tools as a software as a service. They're generally noted as like demonstration environments only, but available to use as folks see fit. Yeah, so all the NIST tooling, I guess to say, is available for download if folks want to configure things locally. And just to walk through the HL7V2 tools, so they include the F1 criterion, which is transmission to immunization registries. This supports immunization reporting, like I mentioned. This is the HL7V2 immunization test suite. ONC is the steward for this tool, and we work with NIST to develop and maintain the immunization test suite. So that's within their HL7V2 tooling. And then there is an alternate test method available for the F1 criterion. This is the only alternate test method that is available for the public health criteria. And that's the immunization integration program, which is stewarded by several partners, including ERA and HIMSS, and CDC is also a partner. This tooling is also built on the sort of the underlying NIST HL7V2 infrastructure, but it includes a lot of additional utilities, sort of optional utilities for immunization reporting with HL7V2 messages. So there's some quality stuff in there, for example, that's not included in the like minimum requirements for the certification program and included in the main HL7V2 immunization test suite for certification. And then just moving on, F2 is the syndromic surveillance criterion. Our test method is the syndromic surveillance test suite. ONC is a steward for this, and it's also using the NIST HL7V2 tooling. And then the last HL7V2 criterion for public health is reportable laboratory tests and values and results. And then this is also ONC is the steward for this, and it is built using the NIST tooling. And like I said, links to these are available on the main tools page. You can see links to the immunization test suite, syndromic surveillance, and electronic laboratory reporting there too. And then this is just a screenshot of the immunization test suite. Maybe we'll pull this up here. And you can sort of see, similar to several of the NIST tools, we have sort of some context-free testing for different messages if folks want to sort of test, paste in content and validate without any sort of scenario context involved. And then we also have HL7 context-based testing, where these scenarios are designed to test the full breadth of the certification criterion. And so there's generally for each of these, there's a description of a scenario, and information is recorded in the electronic health record, and then a message is generated. So for this one, this V04Z22 is generated and tested using the using this tool, and then you can sort of validate the results. And so if you go through all these, it sort of captures the full breadth of the criterion. And all of the HL7 V2 tooling that or all the criteria I covered look pretty similar to this immunization one. And then this is just a sort of a screenshot of the homepage for the immunization integration program alternate test method. And then finally moving into the CDA tooling, NIST makes available this NIST general validation tool. This is used by a majority of CDA-based tests for certification. I'll mention that they do have some historical tooling for HL7 CDA, which is not part of the GVT, and those are generally just available for download. An example is the National Healthcare Surveys Validator. They have a download link for that in the from the homepage. And but the NIST general validation tool is great. It actually supports testing development for both HL7 V2 and HL7 CDA, and is what all of sort of the new testing tools are generally built on, using GVT, because it's sort of extensible and similar to Inferno in that you can create your own tests. And then just to quickly walk through the CDA tools used in certification. So we have transmission to cancer registries. The F4 criterion uses the CDA cancer registry reporting validation tool. And again, for this one, ONC is the steward for this, and we work with NIST for development. And then F6, this is the transmission to public health agencies, antimicrobial use and resistance reporting. The test method for this is the healthcare associated infection CDA validator. This is we coordinate obviously this tooling for the certification program, but CDC generally serves as a steward for the tooling, contracting with Lantana Consulting to develop the tool. And I'll show that page in a second. And then finally, we have the F7 criterion, which is healthcare surveys. And ONC is a steward for this. There's both, like I said, the historical validator, which is available for download, and then the NIST general validation tool for the SVAP test method, that is, the newer platform. And I wanted to also mention, so you'll notice F5 is missing because that one does not include any sort of software-based tests. That one is a attestation-based criterion. And you'll see, I'm just going to show a screenshot for this one. This looks the screen for the general validation tool, SVAP test method for the NCHS CDA validator looks pretty similar, pretty much the same as the immunization tool that I just showed. and it has sort of context-based and context-free testing, and you sort of walk through a scenario that covers like the full breadth of the criterion. And then finally, this is the sort of a screenshot from the page of the CDA validator that we have for healthcare associated infection. The criterion for this one is pretty simple, since we only require conformance to a couple of the CDA reports within the implementation guide. And with that, we have a moment, we have like 5 minutes. If folks have any questions that they want to throw into the Q&A, it doesn't look like we have any new questions, although, yeah, we do have, is this presentation file available online? Can you share it with us? And yes, we are recording the session, and we will make the recording and the slides available on the healthit.gov events page after the presentation. So I'll just give a moment if folks have any questions that they want to submit. And it looks like we did get some questions answered during this session as well. Great. Well, if there are no questions, speak now or forever hold your peace. Thank you for attending this developer roundtable. We really appreciate your engagement and your participation in the certification program. And please feel free to reach out with any questions or concerns on the ONC inquiry portal, the healthit.gov inquiry portal. Healthit.gov is a good place to find information about the program. And we'll see you at the next developer roundtable. Thanks.